Have you ever sat quietly in your favorite chair, the world around you calm, only to feel your heart suddenly race as though it were chasing a finish line you never entered? Or maybe you've stood up too quickly, and the room tilted, lingering in a haze longer than it should. These small, fleeting experiences are often brushed aside as nothing. But in the language of the body, they can be whispers, coded messages from the heart, quietly asking for attention. Heart failure does not always announce itself with the explosive drama of a heart attack or an ambulance siren cutting through the night. More often, it begins with silence. Small, subtle signs, unnoticed by many, ignored by most. And when overlooked, these signs accumulate like a storm gathering over calm waters. Tonight, we unravel those whispers, magnify them, and confront what they could mean for millions of people, especially seniors who often mistake them for nothing more than aging. The reality is sobering. According to the World Health Organization, cardiovascular disease remains the #1 cause of death globally, claiming an estimated 17.9 million lives every year. Of those, a significant portion is linked not to sudden heart attacks, but to progressive heart failure, a condition that builds slowly, eroding strength and independence in silence. Experts warn, the earlier you listen, the more likely you are to protect your future. Imagine the heart not just as an organ, but as a tireless worker, pumping nearly 2,000 gallons of blood every single day, without rest, without pause. It is the unsung engine of your life. Yet, like any engine, it can wear down, not all at once, but gradually. And in that gradual decline, signs appear. They may be small at first. A skipped beat, a faint dizziness, a tight shoe, a restless night. But together, they form a pattern, a warning. And that warning must not be ignored. The first sign often slips under the radar, an unusually fast resting heart rate. When you're relaxed, watching television, reading a newspaper, your heart should beat steadily, between 60 and 100 beats per minute. But when the heart begins to weaken, it compensates by working harder, pumping faster, even in stillness. People describe it as a flutter, a pounding, a sudden thump-thump in the chest that startles them out of quiet moments. Cardiologists compare this to a tired worker on an assembly line. When falling behind, the instinct is to speed up, to push harder, to keep up with demand. But this frantic pace comes at a cost. The American Heart Association reports that a consistently elevated resting heart rate is directly linked with an earlier onset of heart failure and higher risks of complications. In other words, if your heart is sprinting while you are sitting, it is waving a red flag. This is not a mere passing sensation. Over time, this relentless pace wears the heart down further, creating a vicious cycle. Yet modern technology offers a lifeline. A simple wrist monitor, a pulse check on your smartphone, or even the age-old method of counting beats with your fingers pressed gently to your wrist can expose the truth. Keep a record. If your resting rate often climbs above 100, this is not an inconvenience. It is a call to action. Show it to your doctor. Document it. The earlier the intervention, the greater the chance of protecting the heart from irreversible strain. But let's pause. Because the heart is not only about numbers, it's about life's moments. When the heart begins to fail, it's not just a statistic in a medical journal. It's the grandfather who suddenly tires halfway through telling a story. It's the grandmother who sits out the family walk because the stairs feel heavier than they should. Heart failure steals moments long before it steals years. And that is why these early signals matter. Medical research paints an even more concerning picture. A study published in the Journal of the American Medical Association revealed that many patients diagnosed with heart failure had reported unexplained fatigue, palpitations, or shortness of breath years before their diagnosis, but they dismissed them as just getting older. This dangerous normalization delays treatment, allowing the disease to progress unchecked. And so, the first sign is not just about a racing heart. It's about recognition. Recognizing that your body is trying to speak to you. Recognizing that what feels small today may become unmanageable tomorrow. Recognizing that when the heart begins to whisper, you cannot afford to wait until it screams. This is where awareness transforms into power. The more you know, the more you can act. The more you act, the more control you reclaim from the slow creep of heart failure. Tonight, as we explore these 13 signs, understand this. They are not abstract symptoms listed in a textbook. They are real. They are personal. And they are the difference between catching heart failure early or too late. So let us move forward. Past the racing heart. Past the overlooked palpitations. Toward the second early warning, a signal that disguises itself as something far more innocent. A foggy mind, a fleeting memory lapse, a sudden confusion that seems, at first, like nothing more than age. But, in truth, it is the brain itself quietly sounding the alarm. Have you ever walked into a room and suddenly forgotten why you went there? Or sat at the kitchen table with the morning paper, only to realize that the words were harder to follow than usual? Many brush off these lapses as just aging, or laugh about being absent-minded. But what if these everyday slips are not just quirks of memory, but coded distress calls from the heart to the brain? The brain is one of the hungriest organs in the body. Despite weighing only about 3 pounds, it consumes nearly 20% of the oxygen pumped by the heart every minute. When the heart falters, even slightly, that oxygen supply becomes inconsistent. Imagine a city whose power grid flickers unpredictably. Lights dim, machines stall, systems misfire. That is what happens inside the brain when blood flow stutters. The result? Cognitive decline, confusion, forgetfulness. The Journal of the American College of Cardiology published groundbreaking research confirming that early-stage heart failure often coincides with measurable declines in memory and concentration. Patients who had no prior diagnosis of dementia reported increasing mental fog. They misplaced keys, struggled to recall conversations, or found themselves rereading the same paragraph again and again. To the casual observer, it seemed like aging. To a cardiologist, it was the brain waving a warning flag. This is more than forgetfulness. It is biology in crisis. When less oxygen reaches the brain, the frontal lobes, the regions responsible for focus and decision-making, are the first to suffer. Over time, repeated shortfalls in blood supply chip away at mental sharpness, leaving individuals feeling unmoored, unfocused, or simply off. But here lies the danger. Many older adults dismiss these moments as harmless. They tell themselves it's normal. Their families accept it. Months pass, even years, before anyone realizes that these small lapses were actually early signals of a weakening heart. By then, opportunities for prevention have slipped away. Let's step into the life of a patient. A 72-year-old retired teacher notices she loses her train of thought during conversations. She jokes with friends about senior moments, but quietly worries that something is wrong. One day, after climbing stairs, she feels dizzy and can't remember why she went upstairs in the first place. Her doctor later confirms her heart is pumping at barely half the efficiency of a healthy adult. Those memory lapses, they were not the first steps of dementia, but signs of oxygen starvation to the brain. caused by an undiagnosed cardiac condition. For cardiologists, cases like this are painfully common. Cognitive fog, once thought to be exclusively neurological, is increasingly recognized as a cardiovascular symptom. Dr. Clyde Yancey, a leading expert in heart failure at Northwestern University, has said, "The brain and the heart exist in a delicate partnership. When the heart underperforms, the brain is the first to raise its hand and say, 'Something is wrong.'" But what can you do if this sounds familiar? The first step is awareness. Track when mental lapses occur. Do they happen after climbing stairs, gardening, or late in the evening? Keep a small notebook. Write down the circumstances. These patterns matter. Doctors rely not just on symptoms, but on context, when they occur, how often, and in what setting. Technology can help. 2. Wearable devices now track heart rate and oxygen saturation in real time. A sudden drop in oxygen or a spike in heart rate during moments of forgetfulness can provide critical data. This is not science fiction. It is accessible medicine in your pocket, offering clues that once took hospital visits to uncover. Yet the most important step is conversation. Talking openly with your doctor about memory issues may feel uncomfortable, even embarrassing. Many fear being labeled with dementia or Alzheimer's. But hiding the truth only delays diagnosis. And sometimes, what appears to be neurological decline is reversible because the root cause lies not in the brain itself, but in the struggling heart. This merging of heart health and brain health is reshaping medicine. A growing body of evidence now suggests that protecting the heart early can preserve cognitive function later. In other words, every time you protect your heart, you are also safeguarding your mind, your memories, your independence. The message is clear. Foggy thinking is not just a nuisance. It is not just getting older. It is potentially one of the earliest and most insidious signs of heart failure. Ignoring it risks more than confusion. It risks the very quality of life. And yet, the story does not end here. Because when the heart fails, it doesn't just whisper through the brain. It shouts through the body. One of the most visible signs comes not from within, but from below, from your legs, your ankles, your feet. As day fades into evening, the body begins to reveal the next early warning signal: swelling. Swelling that tells the silent story of blood backing up, fluid seeping where it does not belong, and the heart struggling under pressure. By the time evening settles in, many people notice something they often dismiss: socks leaving deep imprints on the skin, shoes feeling suddenly snug, or ankles appearing puffy and heavy. It's easy to shrug this off as the price of standing too long, walking too much, or simply getting older. But in truth, this swelling, called peripheral edema, is one of the body's clearest, most visible warnings that the heart is struggling to keep up. Here's what's happening beneath the surface. When the heart can't pump efficiently, blood begins to back up in the veins. That backup increases pressure, pushing fluid out of blood vessels and into the surrounding tissues. Gravity pulls this fluid downward, so the ankles, feet, and lower legs become the first battleground. What looks like tired feet at day's end is actually a red flag of poor circulation and mounting strain on the cardiovascular system. The National Heart, Lung, and Blood Institute has documented this phenomenon for decades. Bilateral swelling, appearing in both legs rather than just one, is a common hallmark of early heart failure. The more advanced the condition, the more pronounced the swelling, sometimes rising to the calves or knees. But it rarely starts with drama. At first, it's subtle. A faint tightness. A small dent in the skin where a sock once rested. Silent, yet significant. Doctors recommend a simple test that anyone can do at home. Press your thumb gently against your shin bone for several seconds. If a visible dent remains after you remove your thumb, this is called pitting edema, a classic sign of fluid retention. It may seem like a harmless trick of the skin, but it is often the body's way of saying, the pump inside is struggling. Consider the story of James, a 68-year-old grandfather. For months, he ignored his swollen ankles, blaming them on too much gardening and his favorite salty snacks. But when his swelling worsened, he gained weight overnight, and he began gasping for air climbing the stairs. He finally went to his physician. The diagnosis: early-stage congestive heart failure. Had James dismissed his symptoms longer, his condition might have spiraled into a medical emergency. This is where perspective matters. Swelling does not always come from the heart. It can be caused by kidney issues, liver disease, or even certain medications. But in seniors, especially those with high blood pressure, diabetes, or a history of heart problems, ankle swelling should never be brushed aside. Cardiologists urge, better to ask questions early than face consequences later. The broader data paints a sobering picture. According to the American Heart Association, nearly 6.7 million adults in the United States are currently living with heart failure, and for many, swelling in the lower body was one of the earliest signs. Worldwide, the numbers climb even higher. Yet, too many of these cases are diagnosed late, because what could have been spotted in the ankles was dismissed as just aging. But swelling is not just about discomfort. It's a story about burden. As fluid builds up in tissues, it doesn't stay confined to the ankles. Over time, it shifts upward, straining the abdomen, the lungs, even the heart itself. This creates a vicious cycle. A weak heart causes fluid buildup. The fluid buildup strains the heart further, and the downward spiral accelerates. This is why experts emphasize daily self-monitoring. A simple weigh-in each morning can catch sudden fluid retention long before symptoms become severe. A gain of 2 or 3 pounds overnight, or 5 pounds in a week, is often not fat but fluid. For doctors, this is actionable information, a warning that medications may need adjusting, that salt intake should be reduced, or that the heart's workload must be carefully managed. And then there's the emotional weight. Swollen legs are not just a medical symptom. They affect dignity, comfort, and independence. Seniors often feel embarrassed, hiding their legs or avoiding social activities. What begins as a medical concern evolves into isolation, robbing life of joy. But when recognized and addressed early, treatment can not only reduce swelling but restore confidence and freedom. The dramatic truth is this: your legs can tell the story of your heart. The imprints of socks, the tightness of shoes, the heaviness at night, these are not cosmetic inconveniences. They are physical evidence of an organ under stress. And yet, the swelling is only part of the story. Because while fluid collects in the legs, another symptom lurks higher, one that can leave you dizzy, off balance, and even in danger. A symptom often mistaken for clumsiness or age, but in reality, a sign that the brain is starving for blood flow. That symptom is dizziness, and it may be the next whisper of heart failure, hiding in plain sight. Picture this. You rise from your favorite chair, expecting nothing more than a gentle stretch in your legs. But instead, the world tilts. For a few seconds, the room spins, your balance falters, and you clutch for something steady. Maybe you laugh it off, blaming yourself for standing too quickly. Maybe you tell friends, "I guess I'm just getting older." But dizziness, especially when it happens repeatedly, is rarely just about age. It is often the body's alarm bell, ringing because the brain isn't receiving enough blood. When circulation weakens, Even simple movements, standing, walking across a room, or bending slightly, can trigger a sudden drop in blood flow. The result is lightheadedness, blurred vision, or the terrifying sensation of nearly fainting. For seniors, these dizzy spells carry an extra danger: falls. According to the Centers for Disease Control and Prevention, CDC, falls are the leading cause of injury among older adults, and dizziness linked to heart problems makes that risk even greater. But why does this happen? The heart is a pump designed to deliver a steady stream of oxygen-rich blood upward against gravity to the brain. In heart failure, the pump falters. Blood pressure drops unpredictably, leaving the brain momentarily starved. Imagine flicking a light switch on and off. This is how the brain experiences blood shortages during these dizzy episodes. The European Heart Journal reports a strong link between reduced cerebral blood flow and dizziness in patients with early-stage heart failure. For many, this was one of the first noticeable symptoms before a formal diagnosis. Patients often described it as a wave, sudden, disorienting, and gone in seconds. But the danger isn't just in the momentary spinning. It's in what it signals about the heart's hidden struggle. Consider the story of Evelyn, a 75-year-old widow who prided herself on living independently. She dismissed her dizziness as low sugar or fatigue. One morning, while carrying laundry, she collapsed on the stairs. Her injuries were minor, but the tests revealed the truth. Her heart was failing to pump efficiently, and each dizzy spell had been a silent clue. Her fall was not clumsiness. It was a consequence of a weakened heart. This is why experts emphasize documentation. Each time dizziness occurs, write it down. What were you doing? Standing quickly? Walking after a meal? Did it happen after light exercise? Did it fade after sitting? These patterns matter. To a cardiologist, they are not trivial. They are diagnostic breadcrumbs. In the moment, if dizziness strikes, sit down immediately. Breathe slowly. Let your body recover. Never try to push through it. For older adults especially, the risk of fainting and injury is too great. But beyond these short-term actions, the real solution lies in medical evaluation. Dizziness is a symptom with many causes: inner ear problems, dehydration, medications, but in the context of other early signs, it becomes a loud warning of cardiovascular decline. Technology, again, offers a lifeline. Blood pressure monitors, now widely available for home use, can track drops during standing or movement. This is called orthostatic hypotension, a sudden fall in blood pressure when changing position. If readings consistently plummet when you rise, it's data your doctor cannot ignore. But perhaps the most haunting truth is this: dizziness, though fleeting, has long-term consequences. Each episode is a reminder that the brain and the heart are partners. When the heart cannot deliver, the brain cannot function. The risk isn't only fainting. Over time, repeated shortfalls in blood flow may damage brain tissue, increasing the risk of cognitive decline, even dementia. The takeaway is sobering. Never ignore dizziness, especially when it repeats. It may feel small, but it represents a system under strain. It is the heart whispering once again, "I am struggling." And yet, as troubling as these episodes are, another symptom lurks quietly in the background of many seniors' lives. It arrives not in daylight, but in the silence of the night. A symptom that wakes people from sleep, sending them stumbling to the bathroom again and again, convinced it's just a small bladder. But this, too, is a silent signal of the heart. Frequent nighttime urination, nocturia, is not just a nuisance. It is the next hidden warning of early heart failure. It begins in the quiet hours of the night. You settle into bed, hoping for rest, only to be pulled awake, again and again, by the urge to use the bathroom. At first, you shrug it off. Perhaps you drank too much water before bedtime, or maybe it's just age catching up. But waking 3, 4, even 5 times a night to urinate is not normal. It is a message, and often, it is a message from the heart. Doctors call this nocturia. And while it is commonly associated with prostate problems in men or overactive bladder in women, it is also one of the early, overlooked signs of heart failure. The reason lies in fluid dynamics. During the day, fluid builds up in the legs and ankles because a struggling heart cannot circulate blood efficiently. When you lie down at night, that fluid shifts back into the bloodstream. The kidneys, now receiving an increased load, respond by filtering more. The result: repeated trips to the bathroom in the very hours when your body should be resting and healing. The Cleveland Clinic warns that nocturia often appears before more classic symptoms of heart failure. What seems like a minor inconvenience is actually a reflection of fluid overload, an early breakdown in the heart's ability to maintain balance. But the consequences extend far beyond disrupted sleep. Every trip to the bathroom is a disruption of the body's restorative cycle. Over time, this poor sleep erodes energy, weakens immunity, and, ironically, places even more stress on the already burdened heart. Consider how it feels. The clock reads 1 a.m., then 3 sao, then 5 o. Each interruption chips away at deep sleep, leaving you exhausted by morning. Day after day, the fatigue accumulates. Many patients describe it as living in a fog, tired, weak, and irritable. But this exhaustion is not merely about poor rest. It is a consequence of heart failure quietly advancing in the background. Imagine Martha, a 70-year-old retired nurse. For months, she woke 3 times a night, convinced it was part of getting older. She told no one, not wanting to complain. But when her fatigue grew unbearable and her ankles began to swell, she sought help. The diagnosis: early heart failure. For her doctor, the frequent nighttime urination was not a random bladder issue. It was a red flag, waving loudly in retrospect. Experts stress the importance of observation. Keep track. How many times do you wake to urinate? Does the number climb as the week progresses? Is it paired with leg swelling by day's end? These patterns offer vital clues. Even something as simple as writing "woke up 4 times tonight" in a notebook can be the difference between early detection and late-stage crisis. There are small adjustments that may help reduce symptoms. Elevating the legs during the day can limit fluid pooling. Reducing salt intake can decrease fluid retention. But these are supportive steps, not solutions. If nocturia persists, especially when paired with swelling or shortness of breath, it demands medical evaluation. Because in truth, it is not your bladder waking you, it is your heart. Research confirms this. A study published in the European Heart Journal found that older adults with frequent nighttime urination were significantly more likely to develop heart failure within years. For cardiologists, nocturia is no longer just a urological complaint. It is a cardiovascular clue. And the consequences ripple outward. Beyond fatigue and poor sleep, nocturia increases the risk of nighttime falls. Each stumble to the bathroom in darkness becomes a potential accident. For seniors, these falls can be catastrophic: fractures, hospitalizations, even loss of independence. Once again, what seems small can carry devastating weight. But if the heart speaks at night through nocturia, it also speaks in the daylight through the body's temperature. Another quiet yet haunting sign emerges when the hands and feet grow cold. Cold even when the room is warm. Cold even when others are comfortable. This chilling sensation is not always about weather or circulation in the limbs. It is the heart rationing its limited resources, protecting the brain and vital organs at the expense of the body's extremities. Cold hands, cold feet. Another whisper of heart failure. You notice it when shaking someone's hand. It feels colder than it should. Or perhaps it's while sitting in a warm room, wrapped in a sweater, yet your fingers remain icy, your toes numb. Friends may joke about your bad circulation, but in reality, this coldness can be something far more serious. The body's survival strategy when the heart is no longer able to keep up. Here's why. The heart's primary duty is to supply oxygen-rich blood to every corner of the body. But when it weakens, it must make choices. To keep the brain, lungs, and other vital organs alive, it diverts blood away from the less critical regions, the hands, feet, and skin. The result: extremities that feel persistently cold, even when the environment is warm. Cardiologists often describe this as a silent redistribution. The body is rationing, quietly redirecting its limited resources. While the skin chills, the core fights to stay alive. What feels like cold hands is, in truth, the fingerprint of a struggling heart. Studies in the Journal of Cardiac Failure have highlighted this phenomenon. Patients with advanced heart dysfunction often reported persistent coldness in their extremities, sometimes years before diagnosis. In seniors, this is especially dangerous because it is so easily dismissed, chalked up to aging, poor circulation, or seasonal changes. Consider Harold, a 72-year-old retired teacher. For months, he wore thick socks to bed, convinced the draft in his house was to blame. But when fatigue, swelling, and breathlessness joined the coldness, he learned the truth. His heart was in decline. Looking back, those icy feet had been an early warning sign, a quiet signal he never thought to connect to his heart. There are practical ways to check. If your hands or feet remain cold, even in a warm environment, compare them to someone else's touch. If yours feel noticeably cooler, and especially if this occurs alongside fatigue, swelling, or dizziness, it is time to take notice. The heart is not pumping strongly enough to reach the farthest edges of the body, and the implications run deeper. Reduced circulation does not only cause discomfort, it can damage tissue. Skin becomes fragile, healing slows, and the risk of ulcers or infections increases. For seniors, who already face slower recovery, this can create a cascade of health complications. What's more, the emotional toll should not be ignored. Cold extremities often bring a constant sense of unease, an awareness that something feels off. Patients describe withdrawing from activities, avoiding going outside, or layering clothes even in summer. Life becomes not only physically colder, but emotionally smaller. Doctors urge a simple truth: do not ignore the chill. It is not always just bad circulation. When paired with other early symptoms, swelling, dizziness, nocturia, it becomes part of a pattern pointing squarely at the heart. And yet, while coldness in the extremities is the body's way of conserving energy, there is another symptom that strikes deeper, into the lungs, into every breath. At first, it appears only during exertion, climbing stairs, carrying groceries, walking a block. But as the heart grows weaker, it follows you everywhere, even into sleep. That symptom is breathlessness, the most haunting whisper of heart failure, and often the one that finally forces patients to seek help. It begins innocently enough. You climb a short flight of stairs and pause at the top, hands on your knees, catching your breath. Perhaps you laugh it off. I'm just out of shape. But over time, the moments multiply. A walk to the mailbox leaves you winded. Carrying groceries feels like a workout. Even lying down in bed brings an unsettling tightness, as though your lungs can't fully fill. This shortness of breath, known medically as dyspnea, is one of the most telling and frightening early signs of heart failure. Unlike the quiet symptoms of swelling or cold extremities, breathlessness is impossible to ignore. It steals independence, drains energy, and casts a shadow of fear over even the simplest daily tasks. Here's why it happens. A weakened heart cannot pump blood efficiently, causing fluid to back up into the lungs. The lungs, instead of exchanging oxygen freely, become heavy and waterlogged. Breathing transforms from an effortless rhythm into a conscious struggle. Each inhale feels shallower, each exhale less complete. For seniors, this is often the moment when whispers of heart failure become a roar. The American Heart Association notes that dyspnea often appears first during physical exertion, but as the condition worsens, it may strike during rest or sleep. Some patients wake suddenly in the night, gasping for air, a phenomenon called paroxysmal nocturnal dyspnea. Others must prop themselves on pillows just to breathe comfortably. This is not just discomfort. It is the heart sending an urgent, unmistakable signal. Consider Rosa, a 69-year-old grandmother who loved gardening. She noticed that tending her flowers left her unusually winded. Soon, she struggled even with light chores. Her doctor explained what she had never suspected. Her breathlessness was not from aging or pollen allergies. It was early-stage heart failure. With treatment, she regained strength, but the memory of gasping for air remained etched in her mind. The emotional toll is immense. Breathlessness strips away confidence. Many seniors stop walking with friends, stop traveling, even stop leaving the house, fearful that they'll be left breathless in public. Life narrows, not just physically, but socially and emotionally. Anxiety often compounds the condition, creating a cycle where fear itself makes breathing harder. Doctors emphasize the importance of observation. When does breathlessness occur? Is it only with exertion or even at rest? Do you wake at night struggling for air? Do you need more pillows to sleep comfortably? These details guide diagnosis and treatment. And there is hope. With early intervention, medications to strengthen the heart, lifestyle changes, fluid management, breathlessness can be relieved. But untreated, it worsens, often leading to hospitalization or crisis. The larger truth is this: breathlessness is the body's most urgent plea. While swollen ankles, dizziness, nocturia, or cold extremities whisper, shortness of breath shouts. It is the heart declaring, "I cannot keep up." And yet, there is one final early warning sign, subtle, often overlooked, but deeply revealing. It is not measured in steps, breaths, or swelling, but in something more fragile: energy itself. The persistent fatigue that creeps into every day, turning once simple joys into exhausting tasks. Fatigue, silent, heavy, relentless, is the last of the hidden whispers of heart failure. Fatigue is different from ordinary tiredness. Ordinary tiredness fades after a nap, a night's sleep, or a quiet afternoon of rest. But the fatigue that accompanies early heart failure is heavier, deeper, an exhaustion that lingers no matter how much you sleep. It is as though the body has been robbed of its spark, leaving every task, no matter how small, feeling monumental. The reason lies in oxygen delivery. A healthy heart supplies every muscle, every cell, with the fuel it needs to work. But when the heart weakens, circulation slows. The body, starved of oxygen and nutrients, begins to shut down non-essential functions to conserve energy. Muscles tire more quickly. The brain struggles to focus. Even the immune system weakens. The result is a crushing, unshakable sense of weariness. Studies published in the Journal of the American College of Cardiology reveal that over 70% of patients with early heart failure report persistent fatigue, even before they notice swelling or shortness of breath. Fatigue is often their first clue that something is wrong, though few connect it to the heart. Many dismiss it as aging, stress, or just being out of shape. Consider Margaret, a 74-year-old who loved knitting for her grandchildren. Over time, she found herself too drained to hold the needles for long. She napped constantly, yet never felt rested. For months, she blamed menopause, poor sleep, and arthritis. Only later did she discover the truth. Her heart had been quietly failing, and her fatigue was not laziness or age. It was a warning. The tragedy is how often fatigue steals life unnoticed. Seniors stop gardening, cooking, or playing with grandchildren, not because they don't want to, but because their energy is gone. Joyful routines slip away, leaving isolation and frustration in their place. Emotional fatigue layers atop physical exhaustion, creating a cycle that deepens both body and spirit's decline. Doctors advise watching for specific patterns. Do you feel exhausted even after a full night's rest? Does simple activity like showering, dressing, or cooking leave you drained? Do naps offer little relief? If the answer is yes, and especially if fatigue appears alongside swelling, dizziness, or breathlessness, the cause may not be age. It may be the heart. What makes fatigue especially dangerous is its subtlety. Unlike sudden breathlessness or dramatic swelling, fatigue creeps in slowly. It gives the illusion of normal aging, allowing heart failure to advance undetected. Yet, for those who listen closely, it is the heart's final early whisper, the last warning before the condition grows louder, harsher, and more life-threatening. Taken together, these 8 symptoms, swelling, dizziness, nocturia, cold extremities, shortness of breath, and fatigue, form a pattern. Alone, each can be explained away. Together, they tell a story too urgent to ignore. The story of a heart asking for help. But knowing these signs is only the first step. The greater question remains: what can seniors, families, and caregivers do when these whispers appear? How can action replace silence and prevention replace crisis? Imagine lying in bed at night, your body longing for rest, but your chest refusing to cooperate. You turn to your side, then back again. You prop up one pillow, then 2, maybe 3. Still, a suffocating heaviness grips your lungs. This is not insomnia, and it is not ordinary snoring. This is orthopnea, the inability to breathe comfortably while lying flat, a powerful and often overlooked warning sign of early heart failure. In healthy circulation, when a person lies down, gravity redistributes blood evenly through the body. The lungs remain clear, and the heart adapts without difficulty. But in heart failure, a weakened heart cannot keep pace with this shift. Fluid that is pooled in the lower body during the day flows back toward the chest. The lungs, already struggling, become congested. Breathing feels labored, as though a weight is pressing down on the chest. Relief comes only when the upper body is elevated, forcing many to sleep half-sitting or in a recliner. The New England Journal of Medicine identifies orthopnea as one of the most predictive symptoms of progressive heart failure. Its presence, even in mild form, is a sign the disease is advancing. For doctors, the number of pillows a patient needs at night often becomes a shorthand diagnostic tool. 1 pillow is normal. 2 may raise suspicion. 3 or more is often a red flag. Beyond discomfort, the consequences of nightly breathlessness ripple through health. Sleep becomes fragmented, robbing the body of its natural repair cycle. Poor sleep elevates blood pressure, impairs memory, and weakens immunity, compounding the burden on a struggling heart. Over weeks or months, this cycle accelerates decline, leaving the patient weaker, more fatigued, and increasingly vulnerable to hospitalization. Consider the story of Harold, a retired schoolteacher. He brushed off his nightly struggle with pillows as just old age. He laughed when his wife teased him for building a pillow fortress. But one evening, while attempting to lie flat, Harold gasped so violently for breath that his family rushed him to the emergency room. Doctors later explained his body had been warning him for months. His fortress of pillows was not a joke. It was a desperate adaptation to a failing heart. What makes orthopnea so insidious is its tendency to be dismissed. Seniors may assume they simply snore more, or that indigestion is the cause. Families may not notice until the number of pillows grows steadily higher. Yet the symptom is as clear as a flare in the night sky. A heart burdened by fluid, struggling to maintain balance. The Cleveland Clinic emphasizes one simple test. Track how you sleep. Do you wake suddenly gasping for air? Do you find comfort only in an upright position? Do you need more pillows than before? Writing these observations in a sleep diary provides critical clues for doctors, helping them intervene before a crisis occurs. The haunting truth is that for many, this nightly struggle becomes a turning point. Orthopnea is often the moment when whispers become shouts, when what seemed like ordinary fatigue or swelling is suddenly revealed as something more dangerous. Yet, within that revelation lies an opportunity. Because when caught here, at this stage, heart failure can still be managed. With timely treatment, medications, lifestyle changes, monitoring, the spiral into hospitalization can be delayed, even prevented. The night does not have to be a battleground. With awareness, support, and care, the bed can once again become a place of rest, not fear. But it begins by listening to the signals that surface in the quiet hours, when the body speaks most honestly. Weight gain is often celebrated in childhood and dreaded in adulthood. But there is one kind of weight gain that is neither a sign of growth nor indulgence. It is a warning. A sudden increase of 2 or 3 pounds overnight, or 5 pounds within a week, is rarely about food. More often, it is about fluid. And when fluid builds up inside the body without reason, the heart is often to blame. In the context of early heart failure, the body becomes a reservoir. A weakened heart cannot circulate blood efficiently, and the kidneys, sensing reduced flow, hold on to sodium and water in an attempt to maintain balance. This cascade of biological compensation results in swelling, fluid, that collects silently in the ankles, legs, abdomen, and even the lungs. The bathroom scale, often ignored, becomes one of the most sensitive tools for early detection. The American Heart Association has issued repeated warnings. An overnight weight gain of more than 2 pounds, or a weekly increase of more than 5, should be treated as a red flag. For doctors, this is not about vanity. It is about survival. Rapid weight gain is one of the earliest measurable signs that the heart is slipping out of balance, long before a person collapses or gasps for breath. Consider Thomas, a 69-year-old mechanic who prided himself on eating carefully and walking daily. One morning, he stepped on the scale and was shocked to find he was 3 pounds heavier than the day before. He had not indulged in sweets, nor skipped his routine. Over the next 3 days, the number continued to climb. At his doctor's urging, Thomas was admitted for evaluation. Tests revealed fluid had been pooling in his lungs and abdomen. Without that morning weigh-in, he might not have sought help until his condition had turned critical. This is the hidden cruelty of fluid retention. It disguises itself as ordinary gain. Patients believe they are putting on weight from poor diet, when in reality, They are drowning internally. Shoes no longer fit. Rings become tight. Clothes pinch at the waist. For some, even breathing grows difficult as fluid fills the chest. And yet, because it does not cause pain, many dismiss it until it is too late. Medical research underscores the seriousness. A landmark study published in Circulation found that daily weight monitoring reduced hospitalizations for heart failure patients by nearly 50%. Those who ignored their scales, by contrast, were far more likely to arrive at emergency rooms with advanced fluid overload, requiring urgent diuretics, oxygen, and sometimes intensive care. Doctors recommend a simple, life-saving habit. Weigh yourself every morning at the same time, before breakfast, wearing the same amount of clothing. Record the number in a logbook. If the number jumps suddenly, call your healthcare provider. This single act, a 30-second ritual, can mean the difference between a manageable adjustment in medication and a dangerous crisis. Yet beyond science, there is an emotional cost. For many seniors, sudden weight gain undermines self-image. They feel betrayed by their bodies, embarrassed by swelling, reluctant to speak of it aloud. Families sometimes mistake it for overeating, adding guilt to fear. But here lies the truth. This weight is not their fault. It is their body's cry for help, a signal that must be answered with compassion and action, not judgment. Rapid, unexplained weight gain is not cosmetic. It is cardiac. It is one of the most urgent whispers of early heart failure, and it cannot be ignored. The scale, so easily overlooked in the corner of the bathroom, is in fact a sentinel. Each morning, it silently asks a question. Is your heart holding steady, or is it slipping? Listening to its answer may save a life. The heart and the stomach may seem like distant neighbors in the body, but when one falters, the other often suffers. One of the most overlooked early signs of heart failure is not found in the chest at all. It is found in the gut. A persistent feeling of fullness after only a few bites of food, unexplained bloating, or even the sudden loss of appetite can all point to trouble with the heart. Here's why. In a healthy body, blood circulates freely, nourishing every organ. But when the heart weakens, blood flow slows and fluid accumulates. Some of that fluid leaks into the abdomen, a condition known as ascites. The stomach and intestines, compressed by this pressure, lose their normal function. Meals that once brought satisfaction now bring discomfort. Patients describe it as though their stomach has shrunk, as though there is no room left for food. The National Heart, Lung, and Blood Institute notes that abdominal swelling and poor appetite are among the most common but least recognized signs of early heart failure. Unlike chest pain or dizziness, they masquerade as digestive issues, indigestion, gas, or aging metabolism. As a result, months can pass before the true cause is uncovered. Take the case of Elena, a retired librarian. She had always enjoyed cooking hearty meals for her family, but she gradually found herself uninterested in food. After just a few forkfuls, she felt stuffed. She lost nearly 15 pounds in 2 months, not from dieting, but because her abdomen was filled with hidden fluid. Doctors later confirmed early heart failure. What seemed like a gastrointestinal issue was, in fact, her heart crying out for relief. This loss of appetite carries dangerous consequences. Without proper nutrition, the body becomes weaker, less resilient, and more vulnerable to infections. Muscles shrink, including the heart itself, worsening the cycle of decline. Seniors may brush it off as just not being hungry, but behind that disinterest often lies a life-threatening imbalance. Medical experts emphasize a few questions that can reveal the truth. Do you feel uncomfortably full after a small meal? Has your waistband grown tighter, even though your eating habits have not changed? Do you feel bloated late in the day, regardless of what you eat? If the answer is yes, and especially if this coincides with swelling in the legs or sudden weight changes, the stomach may be telling the story of the heart. Research in the Journal of Cardiac Failure shows that digestive symptoms frequently precede more dramatic cardiac events. Patients often recall months of bloating, tight waistbands, or vanishing appetite before their first hospitalization. In hindsight, these were not random stomach troubles. They were early, silent alarms. Doctors often recommend keeping a food and symptom diary. What was eaten, how quickly fullness occurred, whether bloating worsened in the evening. This record provides invaluable context, helping physicians distinguish between ordinary digestive issues and the systemic effects of heart failure. Beyond the medical, there is the emotional weight. Food is more than fuel. It is culture, memory, family. To lose appetite is to lose joy at the dinner table, to miss out on moments of connection. Families may grow frustrated, urging their loved one to eat more, not realizing the problem is not willpower, but circulation. Understanding this connection can replace judgment with compassion and frustration with vigilance. The message is clear. When appetite fades and bloating rises without explanation, it is not simply a digestive quirk. It may be the abdomen echoing the weakness of the heart. To ignore it is to let silence grow louder. To notice it is to give the heart a chance to fight back. A cough is one of the most ordinary human reflexes. We cough when we have a cold, when dust irritates the throat, when allergies flare. But sometimes, a cough is not about the lungs alone. Sometimes, it is the echo of the heart struggle. In the early stages of heart failure, a nagging, persistent cough, or a faint wheeze that grows worse at night, can be one of the most telling signs that something deeper is wrong. Here's what happens. When the heart cannot pump strongly enough, blood backs up into the lungs. Fluid seeps into the air sacs, a condition known as pulmonary congestion. The result is irritation, inflammation, and a cough that lingers long after colds or seasonal triggers have passed. Unlike bronchitis or asthma, this cough is usually dry, stubborn, and resistant to inhalers. Some patients describe a wheezing whistle in their chest, especially when lying flat at night. The American Journal of Respiratory and Critical Care Medicine identifies this nighttime cough as a hallmark of fluid overload in early heart failure. For many, it appears weeks or even months before diagnosis. Yet because it mimics allergies, asthma, or even acid reflux, countless patients treat the symptom without uncovering the cause. Consider Robert, a 76-year-old who spent months taking over-the-counter cough syrups. He told himself it was just a touch of asthma, or a lingering cold. But his cough grew worse when he lay down, often waking him from sleep. Finally, after a frightening episode of breathlessness, he went to his doctor. Tests revealed his lungs were filling with fluid, his heart unable to keep up with the load. The cough, far from trivial, had been a clear distress signal. Doctors emphasize that the timing and pattern of the cough are critical clues. Does it worsen at night? Does lying flat trigger wheezing, while sitting upright brings relief? Does it resist typical cold and allergy remedies? If the answer is yes, the origin may not be the throat or lungs at all. It may be the heart. The consequences of ignoring this sign can be severe. As fluid builds, the lungs lose their capacity to exchange oxygen efficiently. Breath becomes shorter, fatigue deepens, and sleep becomes restless. Each cough is not just an annoyance. It is the body's desperate attempt to clear fluid that should never be there in the first place. A study in Circulation revealed that nearly 40% of patients hospitalized with heart failure recalled weeks of unexplained coughing or wheezing beforehand. In many cases, they had been misdiagnosed or had delayed care, believing it was a seasonal ailment. For some, that delay cost them precious stability, leading to sudden decompensation. Practical steps can make a difference. Patients are often advised to elevate their heads while sleeping, which can reduce fluid pooling in the lungs and ease the cough. But while this may provide comfort, it is not a solution. The true remedy is addressing the failing heart itself through medication, fluid management, and close monitoring. Families and caregivers play a crucial role here. They may be the first to notice a loved one's nightly cough or wheeze. What seems like harmless irritation may, in fact, be an urgent warning. A simple question: when does the cough get worse? Can unlock the hidden truth and guide someone to timely medical help. The cough of heart failure is not loud, not dramatic. It is a quiet persistence, a whisper that grows sharper in the silence of night. But to those who learn to listen, it speaks volumes. It says, the heart is drowning, and it needs help. There is a moment so ordinary, it often passes without notice. Bending down to tie a shoe, reaching into a cupboard, leaning over in the garden. Yet for those with early heart failure, even this simple act can become a struggle for breath. This phenomenon has a name: bendopnea. And though it sounds obscure, it may be one of the clearest early signals that the heart is under strain. Here's what is happening. When you bend forward, blood shifts toward the chest. In a healthy heart, this shift is easily absorbed. But in a weakened heart, the added pressure overwhelms circulation, forcing blood into the lungs and making breathing difficult almost immediately. Patients often describe it as a sudden, tight breathlessness within 30 seconds of leaning forward. Unlike asthma or obesity, which may cause gradual shortness of breath, bendopnea is sharp, swift, and unmistakable. Research published in the Journal of the American College of Cardiology revealed that many patients with heart failure experience bendopnea, and its presence is strongly linked to fluid buildup and advanced dysfunction. Doctors now use it as a diagnostic clue, asking patients to bend forward in the clinic and describe their breathing. What seems like a trivial discomfort can, in fact, provide a window into hidden disease. Consider Joan, a grandmother who loved knitting and gardening. She began noticing that watering her flowers left her breathless, not from walking, but simply from leaning over. At first, she blamed arthritis and poor posture. Only later did her cardiologist explain that this was not about her back at all. It was her heart, failing to manage pressure shifts that once passed unnoticed. Bendopnea often goes hand in hand with another insidious symptom: persistent fatigue. This is not the weariness of a busy day, but a relentless exhaustion that lingers no matter how much one rests. For many seniors, fatigue becomes the invisible thief of independence. Folding laundry feels like running a race. A short walk leaves them winded. Even conversations feel draining. In studies published in Circulation, fatigue and reduced exercise tolerance are cited as among the earliest and most disabling features of heart failure. Unlike swelling or dizziness, which may appear intermittently, fatigue becomes a constant companion, slowly eroding daily life. Patients often describe it as walking through quicksand or running out of battery before noon. This exhaustion reflects the fundamental problem. The heart is no longer delivering enough oxygen-rich blood to meet the body's demands. Muscles starve, the brain clouds, energy evaporates. Yet because fatigue creeps in gradually, many dismiss it as normal aging. By the time it is recognized for what it is, a symptom of heart failure, the disease has often advanced significantly. But there is hope. These final early signs, bendopnea and persistent fatigue, are not the end of the story. They are the last whispers before the storm, and they can still be acted upon. Doctors emphasize the importance of recognizing patterns. Does breathlessness strike when bending? Does exhaustion persist despite rest? Do these occur alongside swelling, cough, or unexplained weight gain? Each detail adds a piece to the puzzle, guiding timely intervention. For caregivers and families, vigilance is essential. A loved one who suddenly stops gardening, avoids stairs, or needs frequent rests is not just slowing down. They may be signaling something far more urgent. Compassionate attention, without judgment, without dismissal, can make the difference between early care and late crisis. In the end, the message is clear. Heart failure rarely arrives with fanfare. It does not always begin with a heart attack or collapse. Instead, it creeps quietly, speaking through symptoms so ordinary they are easy to ignore. Swollen ankles, restless nights, forgotten thoughts, nagging coughs, breathless bends, unshakable fatigue. These are not inconveniences. They are the heart's language, the subtle whispers before the shout. To hear them, to recognize them, is to grant the heart a chance to heal, to strengthen, to carry life forward. And that is the true power of awareness. It transforms silence into signal, and signal into action. The heart may be failing, but it is still speaking. The question is, will we listen in time? The story of early heart failure is not written in dramatic moments. It is written in the small, almost invisible changes of daily life, the ankles that swell at dusk, the pillow that multiplies at night, the cough that won't leave, the sudden fog of memory, the quiet fatigue that steals the day. Each sign on its own may appear trivial. Together, they form a language, a coded message from the heart, asking to be heard. We have followed 13 whispers of warning. Swelling ankles, sudden weight changes, restless nights, confusion, loss of appetite, abdominal bloating, a stubborn cough, wheezing breath, bendopnea, fatigue. Each one seems ordinary, easy to dismiss, but each one is extraordinary in what it reveals. They are the body's early alarms, ringing long before the sirens of collapse. Science confirms what lived experience teaches us. Heart failure rarely announces itself in one sudden strike. Instead, it advances in silence, hidden beneath excuses of age, stress, or digestion. This is why awareness matters. For the patient, awareness means noticing the difference between tiredness and exhaustion, between a passing cough and a nightly wheeze. For the family, awareness means paying attention to the rhythms of loved ones, recognizing when something is new, different, persistent. For the medical community, awareness means listening, not only to tests and machines, but to the quiet stories patients tell. I can't tie my shoes without losing breath. I don't feel hungry anymore. My socks leave deep marks. These sentences are not casual complaints. They are diagnostic gold, if only we learn to hear them. The tragedy of heart failure is not only its prevalence, but its preventability. With early recognition, medications, lifestyle changes, and careful monitoring, many can live full and meaningful years. With delayed recognition, the cost is steep. Repeated hospitalizations, reduced independence, shortened lives. So the responsibility is collective. Patients must tune into their bodies. Families must observe with compassion. Doctors must look beyond the obvious. And together, society must learn that health is not just the absence of crisis, but the presence of attention. In the end, the heart is not only a pump, it is the rhythm of life itself. When it falters, it rarely does so in silence. It speaks through swelling, coughs, sleepless nights, and fading strength. The question that remains is not whether the heart is speaking, but whether we are listening. Because if we listen, truly listen, these 13 signs are not a sentence of decline. They are an invitation to act sooner, to care deeper, to extend the beat of life. The whispers of the heart are all around us. Let us not wait for the shout.